Welcome to the Journey 2020, where we come to you every Monday at 7 p.m. I'm Charles Morris, happy to be with you on this Monday coming off the weekend. Hope all is well in your world. And as you know, the Journey has been around since 2013, and we talk about some serious stuff and not so serious stuff. As my old co-host used to say, the journey is from me to you and from you to me so we can reach a higher level. And that's what we try to do here at the Journey 2020. Try to enlighten ourselves, educate ourselves, and on the way we try to have a lot of fun as well. And as you know, the third Monday of each month, we have Dr. Kathy Meeks. She is a sex therapist, and so what's more fun than talking about sex? And so with her, she tries to enlighten us and bring forth and to help us to deal with some of just the common issues that we have that sometimes we don't even recognize. The fourth Monday of every month, we have Hakeem Nkrumah from Young Fathers of Central Florida, and he tries to help us with those that's dealing with child custody, with the battle in the court system and the red tape and the relationships and all of the madness that comes along with just trying to see your child. Well, he's here to help you, to answer questions, and to let you know that you have rights as well. So with that being said, make sure that you tune in the fourth Monday of every month as we talk with Hakeem Nkrumah from Young Fathers of Central Florida. He's always looking for volunteers as well. His clientele is young as 12 on up to about maybe 30. So he tries to deal with the younger fathers because he realized that there's very little out there for them. And we kind of have a snobbish attitude toward the teens when it comes to them being fathers, and we think that they don't care, so on and so forth. But I've been in some of those meetings. I've listened to some of these young men with tears in their eyes, trying to fight the system, just wanting to see their sons and daughters and have a better relationship with their children. So with that being said, we thank Haki because he's doing such a great job. He's been around for over 10 years now doing what he does, calling what God called him to do right here in Central Florida, where his program is spanning throughout Florida. He's in Quincy near Tallahassee. He's in Miami. He opened up in one of the other organizations is teaming with him down in the Miami area as well. So there's Young Fathers of Central Florida. Google it. There's 8 programs within the program. So he does a great job. So today, well, I am blessed and I'm happy to have joining me is what I call my little sister. And I've been knowing her forever and a day. And
Yes.
still have conversations about the fact that she left New York City because at this point in time, for a long time, I would be making plans to go and hang out with her like right after Christmas and hang out with her until the new year. Miss Findlay, how are you doing today?
Good morning. Good morning.
How are
Doing
you?
just great.
Yeah, you
Just
you know,
wonderful.
I sit and talk about I lost my New York connection. When did you move back to Florida?
2000 December, actually April 2009. And I missed it every day. Like now, I would
Okay.
love to put a coat on,
Well, let's
get a
go
little bit of
back.
cold.
Let's go back. Let's go back. I met you in college. You were a freshman.
Oh, you're going way too back.
And I always tell the story
Yeah.
about you and your sister. And for some odd reason, we just connected like that. And we just always been friends. And you and your sister, and I got so many stories that I can tell from. I
Yeah.
always love to tell the story of your sister. Of
Oh, I know you was gonna come up with
I
that.
love,
Before you
I
do
love to
that, I
tell
was
the
gonna
story.
tell my story. I was going to tell my story when I first met you. You were sitting in front of the administration building, and I was going over to I think this was the Houston building because I had political science, and I passed you, and you said hi. And then my sister had class early from me, and she was coming from that building, and you said, "It's impossible that you change. How could you change clothes? Because we look so much alike." And then she goes, "Excuse me, who are you?" And then you were still sitting when I passed and said, "What's going on?" And I'm saying, "Excuse me." And I said, "Oh, I have a sister." And said, "Oh, I figure that." because you saw the face look alike, but the different clothing, and that kind of you were a little puzzled with that. I'll never forget that though.
Yeah, yeah, and
Never forget
you
that.
and
That's my
your
story
sister,
of you.
yeah, and your sister and her and that whole thing. I won't even get into that whole thing where her sister said, "I'll never eat anything out of a can," and that was so funny because at the time you were cooking every day, and when you got tired
Yeah.
up and you couldn't cook, and I knocked on that door, and that sister was sitting there opening a can because she was hungry and she wanted something to eat. So I still, you know, I
That's
still
what you
talk
do
about
when you
that.
gotta eat. Yeah.
You got to eat. Well,
Yeah.
what I wanted to talk about today was,
Uh-huh.
you decided to major in nursing. Why did you decide to major in
Yeah.
nursing?
Well, I come from a family of mostly nurses,
Hmm.
teachers, and my grandmother was a midwife, and I used to follow her when I was a little kid, go deliver babies. And she said to me, you should be a nurse or a doctor someday. But I started out wanting to be a doctor, but then I look at the journey, how long it will take, and the cost, and I'm like, I feel more connected to the patients because just like how I saw my grandmother as a nurse and how she would, deliver the babies and she would spend time with the mothers, sitting down, talking, teaching. And I'm like, that's something I like. And it connect with me. So that's when I decided I want to be a nurse because, the doctors don't spend time sitting down, getting to know the patients and stuff. And besides medical, helping them out, finding out, other things about what made you get sick, or, even what are things we can do? Those are what the nurses do. They connect with the patients. And I decided I wanted to be.
Okay. Well, see, it's funny because that's the first time I'm hearing this story. I never knew that after all these years. Now,
Yeah.
now, what was it like for you when you were at that time? Because how old were you if you were going around with her and she
I
was
used to be, I think, around 6 or 7.
and so what was that
Yeah,
like for
around
you to
six
see
or
her,
seven.
delivering babies? What was that like for a six,
Well,
7-year-old?
we couldn't go in the room. I would
Okay.
just follow her. And she deliver babies at home.
Okay.
And this is in the rural areas. So we were
Well,
not
well,
allowed to go in the room.
you need to tell us where you're from because we don't know that. So where
Well,
you from?
this was in Jamaica. This was in Jamaica, and most of the babies are born at home when you're in the country
Mm-hmm.
part.
Mm-hmm.
Of course, some people would go, to the hospital. People that have access to the car, have a car, and are more fluent financially. But the lower people who don't have all those finances, they'll deliver their baby at home with a midwife.
Yeah.
And
And
usually those are what healthy mother, with healthy pregnancy.
mm-hmm.
If a woman has complications, they go to the clinic and they would deliver in the clinic because the clinic will tell them you can't deliver at home. You have to deliver because you have high blood pressure, etc., etc. So these mothers that delivered at home were the healthy pregnancy, put it like
Okay.
that. But of course, any healthy pregnancy complication can arise. But my grandmother is she's from Scotland, so she would train over there. So she was more advanced to the, what I mean, the latest technology, and she would carry everything in her little bag. So complications arise, and I've seen situation where, wow, she got in there, baby was. I remember this little one where the mother was in labor for like, oh my God, we're there all day, and she was I mean, I think her face was swelling up. We call that edema. I remember my grandmother because I peeped through the door. Other kid, you're curious to
Mm-hmm.
see what's going
Right.
on.
Mm-hmm.
She pushed her hand way up there and she literally pulled the baby out.
Wow.
In any other situation, that would be a C-section. Because the baby was, breech. Other way was coming out foot. She pushed her hand way up there, turned the baby, and take the baby out. I'll never forget that. I
Wow.
almost passed out.
Well,
That's why they tell you don't peek at stuff. And those are situations that could happen, and she was able to handle it. Thank God she was trained in a first world country. You know what I mean?
mm-hmm.
Where they're
Mm-hmm.
exposed to more technology. Not that the ones out there didn't, but it's a little bit more modern. And she had all her equipment from over there because she was Scottish.
Okay.
So
Now,
that's the little history.
now let me ask you now because when we go to school, you leave high school And but actually, you know what? How did you end up coming over here to America when you were in Jamaica? How did you end up coming over to America?
My father is an accountant and he got a job at a big accounting firm in New York, and they recruited him because I guess he was really good. And he came here and then we came with them. The company sponsored my dad, so we sponsored my dad and all of us.
Okay.
And that's how
Well
we
then,
get to come here.
okay, then let me ask you this here. Now, when we go off to school, we're kind of clueless in the sense of what college life is about. Were there ever a
Hmm.
time when you said, "Well, maybe I want to major in something else"?
Actually, no, I kind of had my head set on that ever since that moment. So I knew exactly what I want. So I steer myself towards that. And I know some people find their major in college. They don't know what they want until they go. And I wasn't like that. I knew exactly what I wanted and for it.
Right. And so once you graduated, because in the steps of nursing, because that's one of the things that you brought to my attention, which we're going to get to later, about how things are
Hmm.
changing, which is why I wanted to ask you to come on the show. But we're going to get to that later. But what was it
Hmm.
like in the nursing program for you? Was it everything that you expected? Was there any surprises? Did you run into any bumps on the
Oh,
road?
yes, it was very difficult. And I went to school in the, late 80s, 90s. So it's like, I shouldn't say this, but I have to because I went to a big, UCF, and back then too, they didn't see much minority women as nurses. It's mostly, Caucasians, and you to be in the nursing program, they
Mm-hmm.
considered elite and a privilege. So it was very, and the least little step or you slip, you're out of the program. They don't try to do anything to help you, even though we have the minority program there, but the nursing program was very, very difficult. And they tend, what I still see, I don't know what's going on now, but they tends to target the minority students. Like, they would go over your care plan, they would scoop out your assignment, or when you do a care plan, meaning when you write up your patient assessment, they'll give it back to you, do it over. I noticed that a lot with a lot of my friends, and things like that. And when we get assigned to a different hospital, you're supposed to be assigned to different hospital based on your the semester you're in. I noticed one time I got a hospital that was way out of my area while my other friends were going to the bigger hospital. I was went to the teaching hospital way downtown, which was a
Mm-hmm.
blessing for me because it's a hospital where you see and do everything, while the other girls will go to the private hospital really close by where they don't see much and they don't learn much, because the stuff that I saw at the public hospital,
Mm-hmm.
because public hospital is people who don't have insurance, very high risk, have a lot of complications. So you see things that arise that, somebody might go to this hospital because it's private. Oh, I'm having a little bit of headache or a little, you don't see much.
Right.
But there you have people coming in with high blood pressure, cardiac issues, diabetes, and these are the things we get in school. And when you see the patient and you go through their assessment and stuff, when you go to class and you get the test, then you can just picture the patient and just go through the stuff, and you say, oh yeah, she has these symptoms. Oh yeah, when her blood sugar was up, I noticed that they did this and they did that, because you don't get that in the classroom. You see it. That's why we do practicum. You go into the hospital and you see the patient and you take care of the patients, and that's basically how you really learn, because you're able to assess the patient, put your hand on the patient. So me going to the public hospital was a big benefit. But go back to what I was saying with the program, it's like they make it kind of hard for minority nursing students to excel, especially going to a baccalaureate program. They expect you to go to the associate program, which is a community college. They don't expect you to come out with a bachelor's degree. So they tends to, fail a lot of people. They make it hard for you, put it like that. So you just make it harder for them by studying harder.
Mm-hmm.
That's what we did. That's what I did.
Right. So,
It's like that in everything else.
well, yeah, well, living here in America, you only have to talk about that only for a second before we can relate to what you're talking about.
Yeah,
Now,
exactly. So,
now, now, explain to me in the terms of which I can understand. versus going to the community college and I guess getting associates versus a bachelor. What's the difference
Oh
between the
yeah.
two?
It's more money when you go to the hospital. Like they said, if you have a baccalaureate, they pay you like three. Back in the days, they'll pay you like 250 for a bachelorette. If you have an associate, you don't get any extra pay for that, and you can only get management position when you have a bachelor's. That's the
Okay, now
difference. Like you
but
could be a clinician, a educator, or a manager, or a supervisor in the in the hospital system. But in the nursing home setting, it really doesn't matter.
okay,
But if you want to be in management or teach, that's the big difference. And you get more money
okay.
in
Now,
dollars worth.
is that a two-year degree, associates?
Yeah, it's a 2 year, their nursing program there, it's a 2 year degree. While in the university, it's a 4 year. You spend the first year and a half doing your associates, and then your baccalaureate is 2 year. But it's really the same because when you think about it, the nursing program is 2 years, no matter where you go. But in the community college, they shorten it to like a year and a half. So
Oh
it's a
wow.
little bit shorter because they condense some of their program, while at the big university level they stretch it out, I guess, so you can pay more money. I don't know, but it's a 2 year program.
Okay,
You
so
spend like one semester more in college.
okay, now I had a friend that was in nursing that she graduated from FAM, so she
Hmm.
went and then she got a master's in nursing. Then she went and got
Hmm.
a doctorate in nursing. So I guess so she could write prescriptions. So
Well,
what's
no, if she's a nurse practitioner, she can write
yes,
prescription.
right,
Right, that's what she did.
right. So
But if you
kind
have
of
your PhD, you're just teaching. You're just a professor.
explain to me the difference between your bachelor's, your master's, and your PhD. What's the difference as you go from one to the other?
Okay. Well, your bachelor's degree, it's your 4 years. Then if you want to get your master's, you go for a different 2 years. With your master's degree in nursing, then they're the one that you will teach at the university. They're the one that will be the DON, the director of nursing, which is the highest ladder you can go in nursing in the hospital. They will get that job. You have to have a master's to get that job.
No, hold on a second.
Then
Hold on a second. Hold on a second. Hold on a second. So when you say that job, what does that job entail? That what you were just talking about with the masters.
you're the head of the entire nursing department in the
Okay.
hospital.
Okay.
The chief nursing officer, they call it chief nursing officer.
Okay.
You're head of the entire, all the nurses, all the nurse administrator. You're head of the entire nursing um, employee in the hospital.
Oh,
You
okay.
decide how much a nurse should get paid. If a nurse manager needs to get fired, you're the one who will be fired. You're like the head administrator at the
Okay.
hospital.
Okay. Now on to the doctorates.
Well, doctorate people going to get their PhD are the one who wants to be professors, really. But now I noticed that a lot of the DONs, director of nursing, they're getting their PhD because they tend to want to sit on the board. They tend to start training administrators. So very few hospital you'll see the DON get a PhD, but the PhD basically is for people who want to teach and do research, teach at the university.
Now
Basically,
you
those are the ones that get that.
now you're talking about a practitioner.
Now, a nurse practitioner,
Hmm.
after your bachelor's, you go and you get your master's, and they call it the ARNP. You get a master's, and it's a more advanced than the RN. You do an additional 2 more years in a master's program, and you get the ARNP. Now, they see patients independent of the doctor, and they can write prescription, but still, the doctor have to sign off all their notes. Now they have the deal. You can get your PhD in nurse practitioner. So now, again, something the government regulated because of Medicaid patients. They said if you're going to write prescription to patients, you need to get your master's degree. If you're going to see Medicaid patients, because what it is now, the doctors, most patients with Medicaid, they don't see the doctors, they see the nurse practitioner. insurance company, when the patients want to pay less, they see the nurse practitioner instead of the doctors. So most of the Medicaid patients now see the nurse practitioner instead of the doctor, so the government can pay a different amount of money, less money.
Okay, now,
That's all
uh,
it is, and they work independent of the doctors.
okay, now I'm going to say something kind of weird, but it's part of
Uh-huh.
our it's part of our society, and it's part of I guess the way that we think. Now, you would know this in the sense of the question that I'm going to ask. But you know what has
Uh-huh.
always been really weird as a patient when you go to the doctor and wherever you are, and a male nurse come in, and you kind of like, ooh, a guy that's a
Oh
nurse,
yeah, that's
right?
another change. Yeah.
But right. So how? I mean, has it changed any? Because I guess there's always been male nurses, but is it more so now? In
Oh yeah, that's a good, very very good question. Because when I went to nursing school, there was no male nurse in the program. But when I graduated, the lower class, I noticed they had like one or two, and they're the one that would really stand out in the program because they're the only male. But now it's getting very plentiful because a lot of people are doing nursing now, to my point, not for the fact that they want to be a nurse or really want to really take care of patients, but because it's a stable job. Hospitals very rarely got a business, and they always need nurses 24/7. And you can put in a lot of hours. You get to work all the weekends. You want to make extra money because you get paid extra on weekend. You get paid extra on the holidays. It's just a matter of security job. Like remember when a couple years ago, 5 when everybody was losing their jobs, how
right.
companies were downsizing. A lot of people tend to go into the medical field because they see it as a stable field. People leave the airline industry in the airline now. So you see a different kind of people coming in the profession for different reasons. So their passion is not the same as someone who really want to be a nurse. You really jobs seriously. Honest to God, like I can say the same for doctors too. They basically come in there for the money. And
Right.
it's all about the money now. But back to the male nurses and like I work in the intensive care unit and most of the kids are like very sick and very sedated, so they don't know what's going on. But the one that are aware of it, it becomes a problem when you do assignment because the teenagers, female, they don't want a male nurse.
All
And we try not
right.
to assign it to them. And if they do, because you have situation where some of them might be so sick, they still can't change. Some of them will wear diapers and because they're so sick they can't control their bowels or something, and a male nurse cannot change a female patient by himself. A
Okay.
male nurse cannot, they never assign him to do a Foley, meaning put that tube up the through the vagina to the urinary, to the bladder. Only a male doctor can do that, but a
Okay.
male nurse cannot do that on a teenager. But they can do that on an elderly woman, but not on a teenager. So it's kind of make it like for the male only in that aspect, but they're great help when you have to lift and move patients. I must tell you, because we have some, it's a big help. You have a
but
male helping you lift a patient or turn a patient 1, 2, 3, 2 seconds. You don't do nothing. They're done.
but how does that work in the reverse of a female nurse dealing with a young male teen?
Male.
Right.
It's like they don't matter because a young male would never have another male put a Foley in him.
Wait a minute, wait a
That
minute,
it's like I
wait a
don't know
minute,
if it's
hold
a
on, wait a minute, wait a
masculine
minute, wait a
thing.
minute, wait a minute. So here I am, I'm 17, 18, and then I got a female nurse coming in that can do all the things that a male nurse can't do to a female patient. Is that what you're saying?
Yes, because it's a masculinity thing. I mean, you don't want another man touching your junk. I don't know. I don't know what. Sorry for saying that, but that's just how the teenage boys are. We had a situation like that, and he said, "You're not coming here to take care of me, are you? I need the other fee. I need the other nurse. I need the woman nurse." They tend to say that.
No, well,
And
I
now
get.
look at what the world is like.
No, 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 no.
Straight guys really
I
don't want.
mean, I get the
Yeah.
male dealing with the female, but then you got the female dealing with the male. Are you saying that the young teenage male don't require a male? I mean, they don't ask
Most
what
of
they.
them don't.
Oh, really?
No. Yes.
Well, I can say if
Yes.
it's a cute nurse now.
Well, no, they don't. Some of them will, but some of them will feel like, no, I don't need anything. And when they leave the room, they'll call again and said, oh, if I'm passing by, I said, oh, can you help me? I said, who's your nurse? He said, no, I want me. They don't want to make them feel, you know what I mean? Feel bad, but they won't ask them what they really want. They'll wait for see a female pass and say, excuse me, nurse, can you help me? And then you'll see that a lot.
All
So
right.
they tend to, when they make the assignment, they tend not to make it uncomfortable for them in that sense.
Take me back. I'm gonna switch it up just a little bit. Take me back to when you was this little young nurse and you were on the job and you were finally involved into a situation where you was like, wow, this is real. Do you remember that first time when there was a patient and I don't know exactly what it is, but it was something where this person life is in danger and it's crazy right now and you had to just be which where your training came into place and now you realize you was in the real situation where this person needed you.
Oh, there is so many, but there's one that stand out the most. You know, when you're a young nurse and you're just starting out and you look young, and what they do, they train you in all the different, because I'm in maternal trial, meaning pediatrics. So you have to train in all the maternal trial areas: OB, trauma, ER, pediatrics, NICU, and PICU, because I wanted to do pediatric intensive care unit. So as a pediatric intensive care unit, you have to go to the ER first, because that's where we get most of our patients, emergency patients. This is at a teaching hospital, and this is at Jackson Memorial Hospital, the big teaching hospital in Miami. I was in the ER just standing there because they said, when you're a new nurse, they said, oh, just watch me, follow me, because that's all you're supposed to do. Follow the experienced nurse and watch what she does. And sometimes they'll let you do stuff. So the ambulance came in and the paramedics came in, and apparently there was some accident at a construction site of something where a man lost his arm. The paramedics see me standing there looking cute, and he handed me this towel in ice and said, here, take it. And I'm like, what it is? He goes, take it to the trauma room. It was the trauma that was cut, that came in, and they lost his arm, and his arm was wrapped in a towel. Charles, I just stood there holding the towel. I did not know what to do. And one of the nurses says, move, bring it now, because they had to take it to the OR. And I couldn't move. I just stood there with the thing, and she just come and grab it out of my hand. I thought everything out of my body was just going to come down. I had to go to the bathroom. I did not know what to do. Honestly. I just stood there with the arm in my hand, wrapped in towel, in ice, and the paramedics said, take it to the room now. They're rushing it with the patient. Bring that, take it to the room. I just stood there with it. And the nurse had to come and get me. I just stood there with it. I didn't know what to do.
Wow.
And then, of course, your first death. That was another big experience for me. A patient in a code, we lost the patient. So, that was
Well,
another.
I
You
was
know
going
what
to
to
ask you
do.
about that too, because I know in the field that you work in that you see a lot of things. It's kind of like being a paramedic and working in a hospital. I was going to ask you about that, but let me share the story that my friend shared with me, and the one that I told you about. Got a PhD,
Hmm.
and she shared a story with me with her and her best friend. They both went to FAM together, majored in nursing. So they're actually in Miami. And so she said they were like a few years out of college and they're young nurses and stuff like that. And they were somewhere riding around in Miami. And she said this young gentleman was riding on his motorcycle and he was riding without a helmet, and he had an accident. He was riding without his helmet and had an accident, and a car hit him. So she said it was obvious, because I guess his head had bust open or something like that.
Hmm.
And she said her and her friend Pat went over and they saw what they saw. and she said she was really in shock. So her friend was trying to help the gentleman do what she could at the time, and her friend turned around and said to her, said, "Cat, call 911." And
Mm.
she said, "What's the number?"
Wow. Yes, yes. It happens. The
Because she said
adrenaline
she
is
was
like
in shock.
everything is
And
screaming out of
it's
you.
so she said her friend
Something that,
said,
yeah.
her friend told her 911. And she said she just stood there, just she
Not
was
knowing
in
what
shock. And she said
that's
by
it.
the time, the paramedics got there and the cops got there, her friend was still over there trying to assist. And so she said finally when she got her head together, because she said she was over
Hmm.
there throwing up and everything else. And so when she walked over to her friend, the cop stopped and go, "Hey, hey, 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 what you doing?" "Well, I'm a nurse and I'm here to help my friend as well." And the cop turned to her friend and go, "Are you sure she's a nurse?"
Because you're in shock and you're nervous and you never experienced this. Good to go. In
Oh,
code, I'm like my first code when the patient crashed and the doctors are calling for the medication. I couldn't even drop the medication with my hand are shaking so much, and I'm like, somebody have to come and grab it from me, and then I try to do something else, and my hand's still shaking. Like, but you get everything like everything else. You learn, you manage, and you never get used to it because you never get used to somebody died. I've been a nurse for like 21 years now, and I still can't get used to losing a patient.
now go back to your th- your first patient that you lost. Do you remember that?
Oh my God, that's like way back. This is yeah, I'll never forget him. Because when you work in the pediatric intensive care unit, you see all the patients. You see cancer patients, you see surgical patients. It was yeah, it was not the cancer patient. It was a young male. I think he was 19 or 18. It was Labor Day. I'll never forget this. Something, my other hospital, Miami Children. And apparently in the motorcycle racing, I'm not quite sure if it was Martin Luther, but I think it was Labor Day when they come out and they do the bike ride and stuff. So he was doing what they call a wheelie when you flip the bike up in the air and you basically standing on the bike or something like that.
Right.
So what happened? He
He
lost
was doing a
control on the
wheelie.
bike.
He was doing a wheelie.
Is that what they call it? When
Yeah.
the bike stands up in the air
Right. Yeah. Hmm.
on him and came down on him and abdominally messes up his whole abdomen. His skull was messed up, so he was airlifted to Miami Children, and he came straight to the PQ. And actually, he went straight to surgery, where they had to, bore a hole in his brain and putting an EVD drain,
Ooh.
external ventricular drain, to drain out the fluid. Because once your skull is open, pressure comes in, negative pressure, so the brain starts to swell because it's supposed to be a closed area. So
Okay.
now fluid has to come in to protect the brain. So the brain starts to swell. So the brain needs protection around it. So they put that drain in to drain out some of the fluid. So he came to me. He was only 18. I'll never forget this. He was just bleeding everywhere. We gave blood. We were pushing the whole entire night. We worked on that kid from 8 o'clock until like 4 o'clock in the morning. And that's when he died. And I just started crying in the room, and they told me to leave the room. And the doctors were like, "What's wrong with her? Get out of here!" And like, you never seen this before. I'm like screaming, and there's blood all over me because of all the blood we're pushing. So that took me back,
Yeah.
and
And
that was my first. It was a horrible one. But then later on, the doctor came and explained to me and apologized because he didn't know that was my first. I'm a new grad, and that was my first death, and the kid is so young. And in an emergency, they want you to move. They're screaming stuff at you, and you're just standing there. And I'm
what
seeing
is
the kid.
what is that like, Geraldine? What is that like working in the emergency room when there's something critical like that and there's madness and craziness? It's almost like being and 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 I'm making an analogy here, like being in war and you see this and all this stuff is going on, and you have
Exactly.
to
You have to start
mentally be in a
administering.
place
Yes.
where you're strong and able to think. When did you get to the
Yeah.
point where you can now think and operate?
After
What?
a couple of them, after a couple of them, it's like nothing to me. It took me like 2 years after getting a couple of them. It is because they're shouting stuff at you. Give me this, give me that. No, grab this, and you don't have it in the card because we have an emergency card where everything is, and you can't find it. So where is my epi? I need epi, and then same thing as crush mash.
Hmm.
It's like kind of like that, but a little bit more crazy. And then doctors are throwing stuff, and and you have to label everything, and you have to make sure what you're giving him is the correct amount. And but you get used to it now. And with new technology now, we have everything lined out. We have a crash card sheet. We know exactly how much to give, the amount. We have pre-print labels. You just pull the label, take the meds, slap it on their hand in the syringe. And you always have one person doing meds, one person charting, one person doing the at the giving all the meds. So it's a little bit more organized compared to back in the days when you were and two other nurses are the only two, and the doctors and maybe the supervisors. So things have gotten a little bit better, and it's a little bit, as years go by, things improve. But back in the days, it was crazy. And for a new nurse, you're just nervous and you just maybe make a mistake, and then you try not to, but
Okay. Now,
you just
now, this is. Let me ask you this right here, because this has to be part of your personality and how you deal with people. Because no matter what field you in, you deal with all kind of
Mhm.
different people. And so I know in an environment like that, especially doctors and situations, so you're dealing with a lot of egos. Very few, and this is my own personal opinion, very few of them are humble enough or take the time enough to know how to deal with you just as a human being versus just saying, I'm arrogant, I want what I want. And in that situation, I have found that very few people are human enough and godly enough to deal with you in a way that's not so arrogant. How difficult has it was for you in that environment, and is it really where you find a lot of doctors are very arrogant and egotistical and may look down upon you as just you being a nurse, you just need to do what I tell you to do? I mean, you know what I'm talking about.
yeah, it's gotten better. It's gotten better now because the fact that you have so many different disciplines now. You have nurse practitioner, you have PAs, and it's toned down a lot because doctors have diminished because there's so many different specialists. So, but yeah, we deal with that a lot, and you basically can't say anything. But now it's a little different. First of all, you used to just suck it up. Now you have resources where you can complain to your charge nurse, your supervisor. Not that you couldn't back then, but it was like, well, you know how Doctor So and So is. That's just how he is. He bring in the most patient in the hospital. So you just suck it up and tolerate it. But not anymore. Now you still have a few of them who would make the smart remarks, and you just basically kind of address it differently now. You'll pull them aside. Or you couldn't. It was so back then.
Yeah, yeah.
It's I don't know what to say. It depends on which state you're working in, because Florida's a right to work state. So it all depends on what state you're working in. And believe me, it's gotten a little bit better. Doctors used to just it's like they were God complex. They had to sit certain chair, and when they come, you have to get up. If you're sitting there charting and they come, you have to get up to let them sit. Yeah,
Oh,
and you
wow.
always have to have their chart ready. If a chart is over there, it's a nurse, can you get me that? And he's sitting right there. He's not gonna get it. He's supposed to have all his chart ready and waiting for him. Everything lined up and ready. It was like they were a God figure back then, but it's not like that anymore.
Wow. Yeah,
The
because
doctors were done.
yeah, my
It is
friend.
used to be a
Yeah,
God figure.
yeah, my friend that I was talking about that was talking about the motorcycle accident, and she couldn't remember to dial 911. She shared a situation with me. This was years ago, and she said the doctor said something to her, and he he cursed at her and he yelled at her, and she turned around
Mm,
and she yelled back at him and said, "You go get it your effing self." And she
And
said
then she
every,
get reprimanded.
huh?
And she's the one that would get reprimanded, not
No,
him.
no, 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 no. She didn't, because of the way that he spoke to her. She
Hmm.
basically, how she explained it, she just spoke to him the way he spoke to her.
He spoke
And
to her.
so
Oh,
everybody in the, and I guess because this doctor was known for being that way and very rude and just talk to
hmm,
people any kind of way. And so she said,
yeah,
with her and her personality, she said, no, I wasn't going to let him talk to me like that. And she
that's
said
right. Now, good
everybody
for
in the,
her.
right, and then she said everybody in the emergency room was like, whoa, because nobody
Yeah,
had
because
ever,
they don't expect that. They don't
right,
expect that.
right, and so nobody had ever responded to him like that. And
I totally
so
can agree with you.
when
Yeah,
she responded to him like that, everybody like, whoa, okay. But then she said when
he never do.
when she was written up or whatever it was, it came back was, it was because of how he responded to her that he didn't have a right to do that.
That's right.
Right. And so there was nothing that came of it, but she said years later that she saw him. They were in the elevator in the hospital together. He walked in the
Mm-hmm.
elevator and he said, "Hey, how you doing?" And then
Oh,
they,
he remember her.
yeah,
Oh, yeah.
but at the
After that.
time she said he was battling cancer. So I think he had humbled himself, at the time.
Oh,
But she said some time later, they were in the she was in the elevator. He got in the elevator and he turned around and said, "Hey, how you doing?" You know. But she said she was the one that responded to this guy the way he talked to her, and she talked back to him because she said everybody else was just afraid of him. And
yeah,
so,
we have doctors like that. Yes, still do. Yeah, we have one like that. You can't say anything to him, and he'll just say whatever he wants, and he gets very upset, and he'll go to your manager and want this one written. If he doesn't have all his chart lined up, I remember this doctor. He was. I'm not gonna. He was, to be honest, he was a god figure. The man was that good. The man, he does spinal rod. People with scoliosis and twisted spine. I mean, I remember the princess came from Saudi Arabia, and her body looks like a perfect Z. The child was, her back was a complete Z. From her thoracic up here to her lower spine was a Z, a complete Z. And he worked on her for 18 hours, and she was straight as a rod, no complications. Patients always come back, no bleeding, because he tends to have a lot of bleeding from the side. His patients are always perfect. And he knows that because he's that good. So he had like a God complex when he came onto the unit back then in the 90s, because I graduated in like 1990. We have to be ready for him at the desk. That's how bad it was. And the managers make us do it. His chair, he has a chair with his name on it. And you cannot, you have to say, yes, Dr. Schaffenberger, yes, I called name, I'm sorry. You have to say yes, and yes, 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 and no, sir, and yes, doctor, so and so, yes, doctor, no, doctor. You can't just say no. You have to say no, doctor, and put his name. Yes, doctor. Is there anything else? That was how we were doing it because he
so,
bought millions in the hospital. You can never talk back to him. You can never say anything to him, and his stuff better be in the room and set up and ready, or else you will really know. That's how some doctors were. This particular one, when they know they're good and they know what they're doing, they expect you to bow to them.
wow,
I've not seen that since, but that was a couple. We had a couple of those, yes.
wow.
Because
Now,
hospitals still till this day, hospitals still have special dining room for doctors, you know that, and they eat for free. The doctors don't eat in the cafeteria with the regular hospital people. They have their own dining room.
well, yeah,
Mm-hmm.
yeah, I can kind of understand that a little bit, but now, well,
Mm-hmm.
one of the
That
reasons that
goes
I
back.
one of the reasons that I wanted you to come on the show is that kind of break it down to us, the field of nursing, some of the do's and the don'ts. For if I wanted to go in the field of nursing and whatever that is, because there could be different fields of nursing, and I'm
Mhm.
thinking about it. What is it that you would say to me?
Well, nowadays you have where I would, to me, because I work in an intensive care unit where we save life, and the least little mistake you make, you can cost somebody's life. I would tell people to go to a school where you literally go to class and be taught, where you can go in the lab, in the classroom, in the class at the university or community college, wherever. So you can be taught by someone, demonstrate how to do things. So when you go in the hospital, you won't see it. But nowadays, they're getting nursing degree off the computer. You do all your classes on computer. You do all your practical by watching a video and things. And when you're about to graduate, which I think is just, I'm sorry, that's just my opinion, because I see the ones that you can tell the nurses who got their degree in line and the one who actually went to class. Before they graduate, they would spend 3 weeks at, like, you have university will pop up all over the place. You will go to their lab and spend 3 weeks and learn everything that we learn in 2 years. You're gonna learn it in 2 weeks, in 3 weeks, and then they'll spend 1 month doing maybe hospital rotation. And out of that 1 month, they probably only do 3 weeks, and then you're done in nursing. So you can get your fresh out of high school, go online and do a nursing program. And those are the people that you see come on. And when you have to orient them, you get, like, most hospitals give you, as a new grad, you get 3 months of orientation. They're the one that would need 6 months because they don't understand nothing. They can't, they don't get it. Some, I'm not all of them, most of them though. I don't know how they pass the board. That's another. Well, there's so many ways you can study and pass a test, but most of them requires a lot of training. They make the most mistakes because most of the stuff that you do in lab while you're going to nursing school, practice it in the hospital. As you learn it, Charles, you do it in the hospital because each nursing class attached to a hospital rotation. So you go to school for like 4 days, and then on the fifth day you go to the hospital. And whatever you learn that semester, you tend to, they are like med surge. For example, you're doing med surge, you will be assigned to a med surge floor. So what you're learning in the classroom, you're seeing it in the hospital. And then out of that, we have to do one lab day where we go to the lab and we practice doing IV. We're practicing putting a Foley. We're practicing suction a patient. They don't get that because wherever they go to do their 3 weeks of practicum, they might not have a patient that has a trach, which is a tube in their throat. So they will never see a trach. They might not ever get to put a Foley in a patient because maybe the patients they have doesn't need a Foley, and the patient they come in that, you know. So a lot of things they don't get to see or do. They're doing it right there in the hospital as a nurse. So you can only give those, certain patients because God forbid. And I don't know. It's like, but then again, I see a lot of these pop up. We call them the pop up school. A lot of them are closing down because the people that graduate can't pass the boards, and because you have to pass, you have to have a certain percent pass to keep your credentials. And a lot of those schools, when they send them, they're getting 60 and 70% percentile for like 2 3 years in a row, and the board of nursing will put you on probation and then they'll suspend your license. I think there's 3 schools down here now just closed down because the nurse can never get an 80% pass rate, and you must maintain an 80% pass rate to keep your license. So a lot of these people are doing it online, and then, not that, I understand people have a family, but they can't go to class. But that's why they have part-time programs and night programs. Because when I was going to school, we have a lot of moms and parents who were in my program, and they would do the night program or the weekend program, where, for family who have to work, because you have a family and you have to support your family. And in the meantime, you want to go back to school. But now it's so convenient. You can learn nursing right inside on your dining table from a computer. And I
That
always say to people, I always say to people, do you want a surgeon to operate on you who learn how to operate from a computer? You want a doctor who goes into the lab and practice on a cadaver and practice in the hospital. I said to her, do you that? And then she said, I don't think so. Well, I said, think of how a patient would feel, a nurse who got their degree from the computer.
You
That's
know
just
that.
my opinion. I know some people would say you're wrong and this and that. Yeah, there's a negative and a positive, but majority of the time, those are the nurses that make the most mistakes. And if you talk to most of my coworkers who've been a nurse for years, they all have to do that extra training. Because right now I'm training a girl who got her degree from a university. I guess I won't say it, and I'm the second preceptor that's precepting her.
Wow.
So she has another 3 more months, which means she has to work with me. She can't do anything unless I'm there. I have to watch everything she does to make sure she do it right. So she's been in orientation now for 6, going 8 months.
But see, everything you're saying, it's like it's been watered down, and now you're talking about people's lives, and I don't understand how that cleared, and they go, well, this is a good idea. It, of course, if it's being done that way, it goes back to somebody making money. So it goes back to somebody just saying, let's just make some money, but then we don't care about people's lives. So that is just weird to me.
Yeah, because the computer now they said make it easy for people to go back to school and have weekend classes. I can understand take some classes online. Still need they need to make majority. A lot of us older nurses who've been a nurse for say, okay, put some of the work, the book work online, but most of the practice, the hands-on, they need to literally go to the university, to the lab. It's like a simulated lab where we have dummies and mannequins and all that stuff, and really learn some of this stuff so they can practice every single thing that you'll be doing. They don't get all of that because we had to do one day and one hospital day and 3 classroom days in
Now,
every week. I think that should be in corporate program, and you will see a big difference.
Now, I asked you earlier about going into the field of nursing, but there's also, and you can just talk about this for a brief second, about the different avenues of the different type of nursing. Because nursing, there's nursing at a nursing
Oh
home,
yes.
there's nursing in the home, there's nursing in the hospital. Can you kind of break that down of the different variations of nursing that people can go into so they can research and get a better idea of what they might want to do?
Well, first, most people start out in the hospital and then they ventured out. Nursing home nurses, well, nurses who go into the nursing home are mostly LPNs because hospitals don't hire them anymore. And nurses that you see in the nursing home are usually just supervisors. Then you have the home care nurse. I did that for a while just to make some extra money where on my day off, I'll go maybe give an IV antibiotics or give a little, medication of some sort. But you have home care nursing where patients are literally need nurses for 12 hours because they're on a ventilator, a breathing machine. And then you can work in the hospital setting with so many different areas. And what I would love to do, I did it once, but flight nursing. That is such a cool part of nursing. But
What is it?
I did it
What is
one
it
time
called?
and it was about flight nursing.
What is that?
Where you transport patients, sick patients. They need a nurse because you're on IV drips, so you need a nurse to monitor the IV drips and anything. Let's say the patient is start bleeding or whatever, you need to know to put a dressing or what medication to give. Or let's say the blood pressure drops, you can push fluids and stuff like that up in the air in an ambulance. Those are flight nurses.
Okay.
I did it one time, but I kind of didn't like it because the plane had turbulence and it was going up and down, and I was so cautious, and I said that's not for me. But it's one of the highest paying area of nursing. I thought it was the greatest thing to be up in the plane and get to patients, and you really made great money. Money was really good, but we had that turbulence, and I thought I would have vomit on the patient. I had to put a mask on. Yeah, I almost vomited, and I couldn't do it. And those are what you see when they say airlift the patient. When are in a airlift them for another hospital because that hospital don't have the doctors or the facility to treat that patient, then you'll need a nurse, a flight nurse, and a respiratory therapist if they're integrated. And that's a great area of nursing if you love to fly and if you can manage being on a plane.
Right. So,
And you have your, nurses that basically now I find out they work with in the more forensic.
hmm
And you know what that entails. I don't know. You have to be, and you have nurses that work in the prison. My best friend, she's a nurse practitioner in the prison system, and she tells me stories that makes my head turn. And I don't know why she do it every day, but
what now?
it's a
Now,
secure, stable job. That's what she keeps saying. It's a federal job. I said, okay, I love my life. It's a different part of nursing. You have to go in because you can't go in with not even a Vaseline. She said for your lips because they
right,
could use that for other things. You can't go in with anything. You're just there with your and and I don't know. It's like they have to be strip searched before they come in and you treat them up. And I'm like thinking, what if you're in the room with them and they try to strangle you? You had a situation like that.
wow,
That's another aspect of nurses, prisoners.
mm,
Even prisoners need medical care. So that, and then you have the mental, they have the mental institution where psychiatric nurses.
hmm
That's another tough area where you got to really, really love the area to work in. Another area that I find to be tough, postpartum,
oh,
labor and delivery. Yeah,
hmm
that's like what my grandmother, but to me, there's so many different. That's another thing too. Why a lot of people go into nursing because there's so many different areas where you can work, and it's 24 hours, and you don't like one area, you go.
right now,
Uh,
those that can contract themselves out. Let's just say I can. Is that called independent? I'm an independent nurse where I can contract myself out. What steps or what? How does that happen?
Talking about the travel nurses, we
Okay.
travel from state to state or country. Yeah, they're usually contract,
hmm
and that's where they make a lot of money. I did that when I went to New York. I was a contract nurse. I was
Right.
what we call a travel nurse. So they assigned me to one hospital. When my contract ended, I could go to another hospital, or I did my 3 days with my contract, and I could like go find job at another hospital as a per diem nurse. Whenever they need me. Those are what you call travel nurses. They go from state to state, and each contract lasts 3 months.
hmm
So those are the other one. And then you have, nurses who works in doctors, private practice, which is,
Now,
stable 9 to 5.
now let me ask you
There's
this real
so many,
quick. Yeah, no, go
is
ahead.
there's so many areas that a nurse can work in. It's that's the exciting part about it with this job. There's so many rare areas that you can take your skills to. So
Oh,
many.
okay, okay. You got a couple more questions before we out of here.
Yeah.
One,
Mhm.
what was it like when you left Florida and you went up to New York? What was that like? Your first
A
nursing?
big culture shock and a big financial shock. Going back to the doctor part there, being it's a big difference. Doctors in New York are very different from down here. Doctors in New York do not like you to call them doctors. It's a first name basis. Every single hospital that I worked at up
hmm
there, it's like that. And because New York is so union,
hmm
you're treated differently. A lot of things are different, and a lot of I noticed that a lot of the practice that we do here are kind of different in one sense, how we build patients, how we do assignments, and because it's union, you have to be very fair, and you cannot overload the nurses and give them unsafe assignments, things like that,
hmm
because then you have and the hospital could be in trouble. And of course the money up there is so, it's like you're underpaid, way underpaid down here.
Oh,
But I guess it's
okay.
based on the state. In New York, you're well adjusted. Like for the holidays, and especially when the weather is bad, you're being paid really good. And
hmm
during the holidays, when you come in on holidays, you get that extra pay and all the incentives. that come with union. If you ever work in a union institution, you get a lot of perks. So it's very different. I would go back in a heartbeat, but I'm so grounded
I,
now,
you,
you know.
you know, I mean, I tell the people all the time,
I
I
don't
I try to
in a
explain to
heartbeat.
them that the day after Christmas, I'm flying up to New York and come back a couple of days after New Year's, and because I'm hanging out, having a good time in the snow and
Remember
the Christmas time.
9/11? Remember
Yeah,
9/11? You were right there, right after 9/11.
yeah, yeah.
Remember,
Okay, now
you
my
were
last
like
question
right
for you.
there.
My last question for you. Tell us
Mhm.
about Geraldine 20 years ago and Geraldine now in the nursing industry.
That's a really good question. Hmm. Well, I kind of look at things more differently now. I'm heading to retirement more. I'm more settled. When I was Geraldine 20 years ago, if I was making $1 less at this hospital and at this hospital over here pay $1 more, I'm going over there to work. It was, but when longer is more about the money and how much I can make because that's all you think about. But it's now more Geraldine is just settling down, Geraldine looking towards her retirement and still staying with the because I've had management position, I have my master's, and I don't want to leave the patient bedside because I just love the patient care. I don't see myself as walking around with a how do I say it? With my nose up in the air and a pen and a pad. No. I just want to be next to my patient. And Geraldine right now is just looking towards retirement at the bedside nursing. I, Geraldine can't deal with the level stress right now. It's something I don't want. So
Okay.
Geraldine 20 years ago is just settling down Geraldine, looking towards retirement
Yeah.
because nursing is not what it used to be.
When I was there,
But I do love the job.
when I was there like a week or so ago, and I can remember Richard Pryor in one of his stand up, and you can remember when the nurse came in to see Frances, who we was there to see after her surgery, and she was
Mhm.
doing so well. And the nurse said something that Richard Pryor would always say. And the nurse said to her, "The hospital is no place to get well."
Because of all the germs that you can catch around there and so many different people taking care of you in and out.
Right. So
Yeah,
if, well,
but
basically she was saying if you got a chance to go home, go home. The hospital is no place to get well.
yeah,
Right.
because the least thing you can catch about, you know,
Right.
because there's so many different people coming around you and not everybody do, you know, wash their hands or sanitize their hand and it's a lot. It's, you know, it's just, you know, it's a room that how many patients been in, even though they clean the room, the monitors next to you, the stuff that they have to put in you, like, you know, lines and stuff, and how you care for them and touch them, all those things can give you infection, your Foley. So yeah, she's right.
Right.
Get your treatment and try to go home. It's just
Okay.
you alone in that place.
Okay. Well,
So
I'm gonna I'm gonna give you an idea where you can retire. Okay.
okay.
Okay. What I think you should do is take
Mm-hmm.
your 20 plus odd years, right?
Mm-hmm.
Write it down and put
Mm-hmm.
out a book about the do's and don'ts about when you go into a hospital and how to make sure that you're taken care of and what that means. And
Oh, that's
so,
such a great idea.
yeah, and have your
That
little
I'm not.
checklist.
I have to work with a publisher or somebody. That's an excellent. You know how many people buy that book?
Duh.
Oh my
Hello.
God! I think you just give so many people ideas. Oh my Jesus! Just like how they tell you how to raise a baby, a new moms, those kind of book. Oh
Right.
yeah, and it's so helpful.
Right.
That's a great
And so
idea.
what you should do is take all these years that have
Yeah, I
you
incorporate.
have
Yeah,
embraced. You should take your passion and your love and your knowledge, and then you can help
yeah.
others because you can help them understand the do's and don'ts when they go into the hospital, you know, and
Great
and
idea.
be one of the things that
Be looking into that.
when my aunt went into the hospital, this was back in like 2007. My friend that I told you about, the one that was in the accident, couldn't remember to dial 911. When my aunt went into the hospital for a stroke, she was on the phone with
Mhm.
me every day. I'm serious. She was on phone with me every day, telling me what to tell the nurse, what to look for, because her thing was, if you don't have anybody there and they know
Yeah,
you don't have
yeah.
anybody there,
They're
they're going
gonna
to be
ignore
treated
it.
differently than somebody
Mhm.
that knows and somebody that's checking on them. So it's those little
Mm.
things that I'm talking about because it makes a big difference. So that's what
It
I'm
does
talking
make a big,
about.
especially the family that the father says he's an attorney. Everybody's like jumping up and jumping around and making sure everything get, yeah, 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 just like that. Yep, absolutely right.
Okay,
That's what
well,
nurses.
I want you to start working on that book.
I am. I'm gonna be finding out some research on that.
Uh,
But that's an
uh,
excellent point. We could talk more about that.
okay, well, I'm going to be back down to see you sometime soon. I'm not. We're not going to date the show right now, but I'm going to, because you're not supposed to come back and see you in like a week or so. So, oh,
Okay.
did you get your refrigerator? I mean your freezer?
No, not yet.
Oh, okay,
I'm
okay,
doing some work right now on the house. We're not on. Yeah. I'm gonna wait till after Christmas.
okay. You're going to
When
wait
they
till
do the
after
end of year
Christmas.
sellout. That's what somebody said, end of year sellout.
Okay,
You know
okay.
what, with that, guys, come back after Christmas because we have to do inventory, and they
Mm-hmm.
inventory most of the stuff and they drop the price so they can get other stuff to come in because the stores send a lot of stuff, and at the end of the year they have to inventory everything.
Okay, this is
That was one of the stores, the first store I went to.
Okay, this is your last word that I ask. For those who want to go into nursing in this field, you would say what to them? This is my last question. This then we get to say goodbye. You would say what to someone who says, "You know what, Miss Finley, I'm thinking about going into nursing. What advice would you give me?"
Are you sure you want to be a nurse? And if you really want to be a nurse, make sure that's really what you want to do, because you want to be a nurse because you want to help patients, not be a nurse because you want to make money. Make
Okay,
sure that's your passion, because there's going to be a lot of surprises that you might not like, and it's
okay,
hard work.
okay,
So make sure that's what you really want. Go and shadow a nurse in a hospital and see what it's like. Try to do volunteer service in a hospital and really see what it's like. And if that's what you like, then do it.
okay,
But make sure you're doing it because you want to be a nurse. And best thing is volunteer.
okay. All right. With that being said, I want to thank my little sister. You know,
All
she is
right.
she is full of passion, and I know it
Yes.
for a fact. And I still give her a hard time because I missed my trip to Brooklyn,
I
and
I
and
know.
she stayed right there. And then you know what's funny is that when I tell people,
Tell me about your first time on the train, how you fly your wings after I showed you, and like you never
well,
stay home.
no, but people are always confused when I tell them about, and I called it Chinatown because they don't look at that little area as part of Chinatown. But it was all Asians. But anyway, we won't talk about
Yeah.
that. But I miss it,
You're
know.
right.
Yeah,
Another
you know.
show.
Yeah.
That's what
So
we do for another show. Life
right,
in New York, how it's so cultural and a little bit, still a little everybody's in their own little neighborhood. Still,
right. Okay. All right.
every culture has their neighborhood.
Okay, with that being said, we, again, Charles Morris, The Journey 2020, where we come your way every Monday at 7 p.m. at www.thejourney2020.com. I want to thank my little sister, Geraldine, and sharing her knowledge. And for
Thank you.
those who want to go into nursing in that field, if you may have questions, you can email me, and I can pass on those questions to her as well. And we make sure that we will answer any questions that you may have. And with that being said, I'm Charles Morse. Enjoy the rest of your week. You be blessed.